So remember, these point like that. And that you always want to put these in your ear and kind of tap the bell to make sure it's open on the right end. Otherwise, you turn it. Okay. All right. So I'm going to start. Before I even start, I'm going to check the physician's orders and that kind of thing. I'm going to knock on the door. Hey, come on in. I'm going to knock on the door. I'm going to foam in. And I'm going to put some gloves on. And then one of the first things I like to do is verify I'm in the right room. Hey patient, what's your name? And they're going to tell me, Ms. Beatty, I'm James, I'm with respiratory therapy, and I'm here to do an assessment on you. I verified her, I told her what I'm here for, and I explained the procedure. I'm going to do an assessment, which involves checking your pulse, and checking your blood pressure, and checking your saturation.
Do we need to say we verified physician orders before we came in?
Yeah, did that.
Okay.
You feeling comfortable? I'm going to set her head up. Because when we do auscultate breath sounds, the best place to auscultate is the back. Our mannequins are a little bit heavy for that, so we'll just be doing the front. Here, that's better. I'm gonna sit her head up. So she does have chest rise, and you can see her chest rise, right? So that's one thing we can do. So as I am palpating here at her radial pulse, I can be counting chest rise rather than counting the pulse, right? So I'm going to count chest rise for a minute to count her respirations. And there's another way you can do it too. You could ask them if it's okay to touch them. You can place your hand on their chest, and then you can count chest rise or respiratory rate with that as well. But in this case, do your best not to let them know that you're counting the respirations. Otherwise, they can alter their respiratory rate. I think you just stop breathing right in the middle of my assessment. So yeah, code blue. So I'm going to locate her radial artery, and I'm going to palpate, and I'm going to count with my second hand. I'm going to count for an entire minute. I'm not going to do 15 seconds and multiply it by 4. I'm not going to do 30 seconds and multiply it by 2. I want to be as accurate as I can, so I'm going to wait a full minute. Okay? In this case, I'm doing radial. There are other options for pulses. What are those?
Brachial.
Brachial.
Femoral.
Femoral.
Pedal.
Pedal. And then there's the carotid, right? So during our assessment, we're gonna 99.9% of the time we're gonna be checking the radial pulse, and I'm using my fingertips, the tips of my fingers. I don't like to use my thumb because you can actually feel your own pulse in your thumb, and I like to use the very tips of my fingertips. So I'm gonna wait a minute as I count that pulse. I'm gonna record her rate. You're at 60 beats per minute. You're regular. And you've got a normal pulse rate. It's not bounding, it's not thready, it's not absent, it's normal. So I've got that, and I can go ahead and count my respirations. As you know, it's best case scenario is she doesn't know I'm counting them. I got 16. They're regular respirations. They're not any respirations that we associate with our CNS system, like biots or Kussmaul's or anything like that. Measure respiratory rate. So if she has a respiratory rate of between 12 and 16, she's not Brady, she's not tachypnic. It's all normal. Body temperature. So where's the number one place we measure temperature?
Oral.
Orally. And my oral temperature is right here. So what we do is we just grab this. I'm going to place it in here and grab a little sheath for it, and I'm going to place this under her tongue. And then in about 10 or 15 seconds, it's gonna give me a temperature here. What's normal temperature?
98.6 or 37 degrees Celsius.
Okay, so we got that. We're gonna chart that. And we're gonna dispose of this. All right, so now we're gonna get a blood pressure. I'm gonna palpate for her brachial artery. I'm gonna hyperextend that arm a little bit so I can palpate a little bit easier. It's a little bit medial of center, so it's a little bit towards her. Once I palpate it, I'm gonna take my cuff. Most importantly is it's the appropriate size, right? This is gonna fit her right. I've got an arterial mark here, artery mark here. I want to place this right over her brachial artery. Extend that arm, place it over her artery, nice and not too tight, but I don't want to leave a lot of airspace in there either. Okay, I left enough room for a stethoscope under there. Make sure my valve is closed. And then I'm gonna take my stethoscope, put it on, make sure it's open to the right end. I'm gonna place it just under her. There we go. Now I'm gonna pump this up to 180. We're at 180. I'm gonna slowly release, and I'm gonna listen, and I'm gonna see when my little hand starts jumping. As I slowly release it, at 140 I can hear something. And at 60 it fades away. So 140 over 60. Okay, got that. So my blood pressure is 140 over 60. Put that away. And then we're gonna measure her SpO2, which is on the other side. So we'll come over here, make sure that the finger probe is clean with alcohol, turn this on, and we've all done this before. Place this on her finger, and of course, since she is plastic, we're not gonna get anything. We're gonna monitor her waveform. Just to make sure we have a good rate. We're going to monitor a PI, make sure we have adequate perfusion, and we're going to see SpO2 at a heart rate. This heart rate should match what you got just a few minutes ago. We get that, we're good. We'll put that away. We'll turn this off. We'll clean it, and we'll ask the patient if there's anything else that we can do for them. Are they safe and comfortable? And then if the answer is yes, we can deglove and phone out. All right? Any questions?
Yeah,
Two. What are
so
they?
since technically the last step post to get the oxygen saturation, it's like a 5th addition to the why do we do that last in the process, or does it matter?
It really doesn't matter. Yeah.
Okay.
Yeah.
And then can you describe like in this setting what you be looking for us to say as far as pulses, alternates, like?
So an alternate pulse is basically when your pulse gets fainter or heavier. It could be from, for example, if you had like a congested heart failure, or you had any kind of heart defect. It's just a drastic change in your blood pressure. So your pulse will become weaker or stronger as you're palpating. Similar to Pulse's paradox, when you take that deep breath and air trap, causes that decrease in blood pressure. It's going to weaken your pulse. So during inspiration, if you get a weakened pulse, that's Pulse's paradox.
Color's not part of the
Not now,
competency?
but it will be. If it's not on here, it's not part of this competency. But color is going to be. We're going to be checking for digital clubbing, color. This is gonna be get a lot more in depth in the next couple weeks. We're gonna add breath sounds the following week. And I'll go, let's turn on some breath sounds here and I'll show you.
So you would just foam out, close, and then.
Yep,
and
foamed
then-
out and
document.
equal out and chart here.
Okay.
I'm gonna plug Susie in here